Thank you for everyone to be here. So without any further ado, we'll ask the Mayor of Montreal, Ms. Valérie Plante, to speak with you. Thank you, Geneviève. Thank you to everyone for being here this afternoon. I wish to salute Dr. Drouin. We speak quite often these days. Dr. Drouin, who is the Regional Director for Public Health, and I would also like to salute Mr. Liban, who is the Coordinator for Civil Safety for the agglomeration, as well as the Interim Director for the Firefighting Services of the City of Montreal. So before starting, I wish to clear things up. A lot of information has been circulating for the past few hours, so I wish to reassure the population and to tell them exactly what is happening. So no, the city is not confined. It is not in quarantine either, neither today nor tomorrow. If someday it does become the case, it will be at the request of the government of Quebec and public health. And if it were to be the case, it would be done in an orderly and gradual fashion. So I wish to remind you and tell you today that we're not there at all yet. It is normal that the city be prepared for any possibility and that it has plans in consequence. That is what responsible administrations everywhere in the world are doing. And yes, there are certain sectors of the island that are more affected than others, but the situation is worrisome elsewhere in the city. Of course, we're going to be working with public health to limit the spread in a general way. Now, this afternoon, we're going to go to an important stage in our collective fight against the coronavirus. This afternoon at 4 p.m., we have declared the state of local emergency over the territory of the Montreal agglomeration at the request of the National Director of Public Health, Dr. Arruda. Since the beginning of the crisis, we have been working together with the expert team of the Center for Coordination of Emergency Measures and the Regional Direction for Public Health to take the best decisions. The established plan has been very efficient up until now, but taking into account the evolution of the situation, we have today arrived at a point where we must give ourselves new powers, exceptional powers, to be even more flexible. I have declared the state of emergency because our resources for homeless people need reinforcements, and they need them now. Today, it is the most vulnerable people in our society who need us. And I wish to emphasize the heroic work of our community resources from the homeless are doing. I thank them for their hard work. I also wish to thank our Commissioner for people experiencing homelessness, Mr. Serge Laroux. The situation in the day centers and shelters is very difficult right now. Day centers who see 700 people per day are now closed, except for a few exceptions. The shelters that house about 1,400 people per night are reducing their places. For the past week, we've lost about 300. The homeless population ends up without food, without place where they can rest, and without protection, and that is unacceptable. The Premier is asking us to stay home. But staying at home, what does that mean when your home is the street? For over 1 week, the Health Network Plan, as well as the City of Montreal, are operating resources in the field. There's 2 new places downtown at the Complexe Guy Favreau and the YMCA that are there to respond to the needs of shelters that must now decrease the number of available spots. The Royal Vic Hospital, which is being transformed into a shelter for the homeless population that is declared positive to the coronavirus or who are awaiting a diagnosis. And then finally, sanitary pilots have been put in the downtown area. But we have to go further than that. There's new temporary shelters that are planned for in the next few days to be able to make up for the spots that are being lost in other shelters. And we're going to create outside day centers in public spaces that are usually visited by the homeless. We are creating 5 sites that will be able to welcome 1,000 people per day. The first one would be in Square Cabot, together with Résidence Montréal, and a second site very quickly will be set up in the next few days. This sanitary crisis must not become a humanitarian one, and that is the message that I have for you today, and that is why we are acting. That is why we're getting the necessary powers to be able to act. The provisions of the law allow us to take all the measures to protect the life, the health, and the integrity of people. For example, we'll be able to conclude agreements, the necessary, and require private places, if necessary, to house people. We'll also have the ability to make purchases of emergency material as well as food for those shelters and our day centers. We wish to act quickly and efficiently. That is our priority. And it is this agility that we are giving ourselves today. To end with, I am speaking to Montrealers right now because we all have the duty to respect the guidelines from public health. The numbers that we see in the media that we're reading are real. These are real numbers. So we all, each and every one of us, we have to make an effort to limit the spread within the community. It is truer than ever before, and once again, I reiterate and ask the entire population to follow the guidelines that have been clearly established by public health and the Quebec government.
So before giving you news about why we're here today, I definitely wanted to set the record straight. There has been a lot of information going around in the last few hours, so I want to reassure the public and give them an accurate picture of the current situation. So no, the city is not under lockdown, nor is it in quarantine. Not today and not tomorrow. If this happened one day, it will be at the request of the government of Quebec and the Public Health Department. And if it happens, it will be done in a coherent and orderly way. We are not at that point at all. It is absolutely normal for a city to be prepared for any eventuality and to make plans accordingly. That is what responsible administration and cities do around the world. Yes, some areas of the island are more affected than others right now, but the situation is serious and in other areas as well. We will, of course, work with the public health authorities to limit a widespread propagation on the island. We have now moved to an important step in our collective fight against the coronavirus. This afternoon, at 4 p.m., we declare a local state of emergency on the territory of the agglomeration of Montreal. This was the request of the National Public Health Director, Dr. Arruda. Since the start of the crisis, we have worked with the team of experts from the Centre de Coordination des Mesures d'Urgence and the Regional Direction of Public Health to make the best possible informed situation all the time. The established plan has been very effective, but given the evolution of the situation, we have now reached a point where we need to adopt exceptional powers in order to be more responsive. I have declared the state of emergency because our resources for the homeless needs to be reinforced. Right now, immediately. At this moment, the most vulnerable in our society needs us. I want to salute the heroic work of our community resources helping the homeless. And I also want to thank Serge Laroux, the Commissioner of the Homeless at the City of Montreal. The situation in day centers and shelters is very difficult, and so it was important for us to find solution, rapid and efficient solution. The Prime Minister has asked us to stay at home, but we need to ask ourselves, what does it mean staying at home when your home is actually the street? What does it mean? What do you do? So for us, it was really important to assure that the homelessness community would have a roof, some food, and feel secure. So even though there's been a lot of things done in the past week for the homeless situation, we must go even further, and this is what we're doing right now. More temporary shelters are planned to be open in the next few days to cope with the reduced number of beds in shelters. The city will help create outdoor day centers in public spaces frequented by homeless people, where they will also have access to food. We aim to create 5 sites that can accommodate a total of 1,000 people per day. The first will be in Square Cabot in collaboration with Resilience, and a second site will be announced very shortly in the next coming days. This health crisis cannot become a social crisis. That is why we are taking immediate action. The provisions set out in the emergency, that's a difficult word to say, I'm sorry, Emergency Preparedness Act allows us to take all measures needed to protect the life, health, and safety of our citizens. So, of course, we will be able to ask for some private accommodation, for example, offer material and food for shelters as well. So many things that we can put together fast and efficiently. So, and I just want to conclude by saying the same thing I just said in French to all Montrealers listening to us. It is very important to follow the recommendation, follow the different rules that we've been saying over and over, but we all see the numbers in the papers, and those numbers are real. So we do need to make sure that we're all taking this very seriously. We are following the recommendation, and this way we will go through this actually together. So thank you so much for your attention. And I would like to ask the Dr. Drouin to share some words with us on the situation. Merci.
Bonjour à tous.
So hello, everyone. So today is a great day for Montreal. You've all seen the epidemiological situation, the acceleration that we've seen this week. Montreal has community transmission that has been well shown. And today, the National Director for Public Health, Dr. Arruda, is asking us to set up additional measures to reinforce the actions that are already on course so that our entire array of prevention be even more solid. Concretely, the objectives that we wish to pursue with these measures are really to ensure that the population or distancing measures are really applied everywhere, in stores and in public places, to make sure that the people who must be isolated, the cases, the people who are awaiting investigation or results, people who are in places where we've asked them to be isolated, we had to make sure that they respect that isolation order. And of course, extra measures to protect vulnerable populations that are specific to our urban context, the homeless among them. So it really is about these objectives that we're going to emit measures which are not being deployed right now everywhere in Quebec, but for which it is now justified that Montreal take an extra step. As the mayor has said, I wish to reassure you, Montreal is not closed down. Montreal is not closing down. Montreal is not in lockdown or quarantine. The measures that we'll be announcing, we will be announcing as of tomorrow at Public Health. These will be progressive measures that we've already seen, but now we're going to have extra leverage that we'll be working with the SPVM. For example, individual orders for people who do not respect the isolation guidelines. Probably fines for stores that have not yet closed down, or for gatherings that are still being held in certain places. But I wish to reassure people, most of the population is respecting right now the said recommendations. But following the spread of the virus, we can no longer tolerate any leeway about these recommendations. Of course, we'll also be able to go towards progressive measures, as we've been seeing in Europe, linked to the control of people in public spaces. So it will be normal to see more police officers in the street. However, we do not plan on specific measures to just one area. Right now, we can see it clearly. The spread is more intense in certain zones and certain neighborhoods, but very quickly we are in a community transmission staging, so we can see it from one day to the next. It's not just one neighborhood, it is the entire island of Montreal that has to firmly apply these measures. More specifically, the measures applied to homelessness. The leverage that is being given to the City of Montreal today should be understood as being leverage to allow us to be complementary to the health network measures. We announced earlier on this week that health network is already active for the entire health care for the people who are homeless. The screening, somebody who has to be isolated and who is homeless. At the Royal Vic, we are already installing zones at the Royal Vic for these people, specific beds that are dedicated to them for people who are homeless and who need to be hospitalized. So the action of the city will be done in complementarity together with all the homeless who are not ill, but with whom we also have to have social distancing measures. We can no longer have 100 or 150 people in just one room sleeping, and we have to make sure that they have access to food and to basic elements to be able to live and avoid, of course, that there is social tension. So that is the summary of most of the measures, and as of tomorrow, we'll be able to announce them to you more in detail. And of course, I also wish to reaffirm that what we wish is not to be in coercive measures. I believe that the population mainly respects these measures, but now we're going to have to be a little bit more rigorous as Montrealers. Our wish is not to have police officers give tickets left, right, and center. But if it is necessary, we don't have a choice. We'll have to do it because, as we said, we are here to protect our elderly and also to make sure that there is as few hospitalization and deaths associated to this pandemic in Montreal.
I will say a few words in
English.
So, today is a big day for Montreal. As Valérie Plante told us, Montreal is not closing down. We're not closing the bridges. We're not putting Montreal in quarantine. The Directeur National de Santé Publique asked me today to increase the measures to protect Montrealers from the pandemic. We've seen an acceleration in the number of cases that in the last week. We know that we have community transmission. We have mostly in some neighborhoods, but we know that in a few days it's going to be more in more neighborhoods. So the objectives of our strategy is really to put measures to make sure that people do respect the order of social distanciation, businesses that should be closed, and orders to make sure that the people that should be isolated do respect the confinement order. And also, we want to put some additional measures to protect vulnerable population that are specific to our urban context. Those measures are going to be announced in the next days. They are going to be progressive. We are going to see orders, like I said, to make sure that people do respect the recommendation to be isolated or confined. And we may see some fines if businesses do not respect or if we still see gatherings in neighborhoods. And so we're going to be able to announce more precisely what is going to be put in place in the next day with our partners, SPVM. I want to reinforce the recommendations. I think most Montrealers are respecting the public health recommendation, and I thank you because we're going to see the impact of the respect of those recommendations in a few days. I hope so. And you have the power to change the curve of the pandemic. So I ask everyone, we are not here to put fines and we're not here to put policemen in every neighborhood. We just want to make sure that we have a success in our collective efforts facing this pandemic. Thank you. Oui.
The question period has started. Unfortunately, the questions are inaudible. Measures that can be taken in case it is forced by the government. Are you ready, without having anybody panic, to apply bridge controls if we have to get to that? And if so, what is your plan with the collaborations of the Montreal Police and the area of Montreal? I'm going to give you an answer that you might perhaps going to find boring because I'm not going to go further than what might be. It's something that I find unfortunate today is that there's information going around that come from real plans, so it's not invented, but which create a lot of stress. This afternoon, I received a lot of emails from people, a woman who said, I am in the Laurentians, I have to give birth in Montreal because I have a complicated pregnancy. When do I have to come back in the city? And that's just one example, and there's all sorts like that. I want to be transparent with my information, but I am not going to start putting forward scenarios which, honestly, we don't want to apply. But what I can tell you is that in any case, we are ready. And all that has been done since the beginning in collaboration with Public Health, with the Health Network, with the Government of Quebec, and of course, with our Coordination Center for Emergency Situations, the SPVM, and the firefighters. So all that is concerted. If we have to set up other measures, like closing down the bridges, let's say, then we'll be ready. So what would trigger then more constrictive measures? I'm sure that you must have some sort of threshold where you say we have to measure these or start them. Maybe this is for public health? Yes, that's what I was going to say, because for me, the order is going to be coming like the way it was done today. By discussing, we had shared our problems, but basically it's the government of Quebec, together with public health, who is going to be pressing on the button. So who is going to decide on that threshold? Well, it is the epidemiological study that will show us. It's progressing quickly, but we were expecting it. The number of cases that we see today, Friday, was what I had in my head as the Director of Public Health Monday in terms of progression, knowing very well that the cases that we have right now transmit the transmission of 10 or 12 days in the past. So we're not yet quite seeing a slowdown linked to the measures that were announced on the 12th of March, but which were not necessarily applied perfectly right away. I'm thinking it took a few days before the population understood understood the importance, and after that there was the intervention at airports for travelers. What brings us to make that decision, we're looking at the epidemiological situation, the acceleration, everything going on around. We can see very clearly that Laval and the Montérégie are not at all experiencing the same situation as us. And as Dr. Arruda said, it is evolving very quickly, depending on the level of acceleration. Tomorrow we'll be announcing measures, but it's possible that in the following days we'll announce more. And the idea is really to see how the population reacts and implements the recommendations that we are emitting. If we see that we've already restricting travel between regions, it's already something that's been recommended. If we see that it's pretty well applied, well, maybe we won't go up to, putting outright bans. However, we know that in cities for which there has been a very rapid spread and very accelerated growth, it is the kind of measure that we might imagine and that are part of a scenario. But there's not a cutoff. Like Dr. Arruda said, it's not, after 1,000 or 1,500 where we say, okay, we're getting to the next stage. It really is an analysis of the transmission corridors. Of course, we're still with 46% of cases that are associated to traveling. There's a lot of outbreaks, but outbreaks that are a lot in healthcare settings, so we know that the potential for community spread is not the same. So it is that entire situation that is being analyzed to decide whether or not we will add subsequent measures.
Dominique Camongoulet du Journal de Montréal. Je voulais savoir un peu.
I would like to know, you spoke of the fact that you'd be announcing more details, what was going to happen tomorrow with the police officers, but what can people expect as of tonight, since the state of emergency has already been declared? Are certain things going to change quickly? Well, I would tell the population, tonight, like any other evening, it's the same thing. If you respect the recommendations, there shouldn't be an issue. Basically, the first stage is that we make sure that we have the means, except for the homeless, because they will see a very marked difference as of now to be able to respond to their needs. But if people, I'll give you an example. Right now, we have 200 investigations being done per day of people who are confirmed. My investigators are telling me I have 25 to 35 people that I can't even get in touch with over the phone. Where are those people? Well, by emitting those measures, we're going to make sure that they are isolated. We'll be able to make sure that we go see in their homes to make sure that they are respecting the public health directives. So we're not changing the recommendations. We're not changing the intervention of public health. We are just giving ourselves the means to make sure that these people respect the orders. And we're also giving ourselves the needs in more difficult social contexts, which is something that we experienced this week in terms of mental health issues, homelessness, that people to whom we're asking to be isolated, who don't have a place to be isolated, we create that trajectory and we give ourselves the means collectively, together with the SPVM and the city, to make it so that we can have places to isolate these people. Madame Plante, that gives you a lot of latitude in terms of the powers that you have with the SPVM, the police corps. Have guidelines already been sent for what's coming up tomorrow and Sunday? I know that it does give us extra powers, but I think that just to make a parallel, I would like to remind you that the state of emergency was declared yesterday during the floodings. It is exactly the same thing. It gives us the ability to spend more quickly. It also can give us a possibility of sending either firefighting services or police services in certain places, to have certain guidelines be respected, require spaces like we did for the floodings, private places, parking lots. So you have to see it in that perspective. I think that we have to be careful to not send out an impression that the state of emergency, it's as if we were in a repressive state. That's not at all what it is. Montreal, as Dr. Drouin was saying, respect the rules. And we are very proud of it. And I thank Montrealers for this. But of course, we want to send a very clear message that if certain people continue gathering, we've already said it. We like chatting first, but if we have to give a fine, we will do so. We will do what is necessary to make sure that things are respected. But to answer your question, everything is being deployed with the next actions. And the reason that motivated me to ask for extra powers through declaring the state of emergency is really the situation of the homeless. And I want to say, when I said I don't want for this crisis, this health crisis, I don't want it to become a social one or a humanitarian one. That's what I was thinking of, because I felt that despite all of our best efforts of helping out this population that is very vulnerable, that we were getting to the end of our capacity to act. And that is really what motivated us first and foremost.
Bonjour. Bonjour. Bonjour, Kathleen Lévesque, La Presse. D'abord, pour vous,
First, for you, Dr. Drouin, I would like to know, there are close to 1,000 cases right now in Montreal. The West Centre, does it still remain the most important outbreak center? Yes, let me just check. Yes, today, so with the progression of cases, it is still the same territory with 38%. It represents 38% of cases. As I was saying, once again, it's 42% of our cases are associated to a trip and traveling, and we'll see it. The transition will be done, and with the community transmission, there will be a lower proportion throughout the days that are going to be associated to traveling. But we can see it even since yesterday in terms of mapping. We can clearly see that it is starting to be going over to other territories as well. So yes, it is more prevalent in these territories, but the perspective of intervention for Montreal is going to remain one of the entire island. There can be specific interventions in certain neighborhoods to make sure, but we're not going to be targeting one more specific area to say we're going to, put up barricades. It's not at all what we're doing. So do you wish to concentrate police activity? Well, everywhere in Montreal. So there will be guidelines for all patrol officers to respect the basic guidelines, whether for businesses or individual gatherings. If there are issues about certain areas, there will be more intensive. So they're the ones that are going to go knock on people's doors to make sure that, for example, when you were talking earlier on about epidemiological investigations, where we're looking at this, I wanted to give you a little bit more information about this tomorrow, but of course we also want this to be a human approach. We're not saying that the person who hasn't answered the phone, for example, is necessarily at fault. There might be a reason why they are not answering. So we'll be looking at the approach to make it so that the intervention can be done at this meeting that will be done with the specific person. Are there any other deaths in Montreal today? In Montreal, we are at 4 deaths today. 9 people in intensive care and 59 people who are being hospitalized. And the 4 deaths, is it in a specific place? I don't want to say anything wrong, but I think somewhere in a CHSLD, but I'd have to validate with my team. It's not concentrated in only one sector. It's in different places. We always come back to these questions, but concerning police officers, could they go into parks, for example, give tickets? And as of when? We'll be able to give you more details on those elements. It's perhaps not the first measure that we'll be setting up, but of course, when we look at what was done in other countries, where we try that people perhaps stay a little bit more in their own neighborhoods, when they go out, that they don't go out in groups, that when they go and run errands, that they don't go, with the entire family, but that it be just one person. It'll be that kind of measure. We're inspiring ourselves a lot with what was done elsewhere. We don't have any randomized trial, of course, but we really are looking at what European countries and other countries have set up as measures to have social distancing measures be respected.
Good afternoon, Dr. Drouin. Pierre-Albert Sévigny de Suburban. Je pose cette question en anglais.
I will be asking these questions in English because you have people listening in English.
Vous avez du monde sur Facebook et c'est une question qui répète.
It's a question on Facebook, and this question refers to West Island.
English for you. Okay. This morning we woke up major daily newspaper informed us that if we don't want to get sick, don't go to the West Island, which is great news, of course.
It wasn't West Island.
Pardon?
It is not the West Island that is...
western part of the city. I mean, we get it. Could you tell me more about what exactly is happening, A, in Côte-Saint-Luc NDG, and B, within the Hasidic community in Montreal, where there's been one death so far?
I do not have the religious data on the cases that we investigate. It's not a question that we ask. What we know is that we have higher rates, higher rates in some neighborhoods. And yesterday, the median rate for Montreal was 36 cases for 100,000 of population. And we saw in some neighborhoods like Côte-Saint-Luc or like Amstead or Outremont, we had like 200 or 150 cases per 100,000 of persons. So we know there is a concentration. Is it a group of families? Is it a context of people that have traveled or people that have been screened more? This is quite difficult for us to know what are the specific cause around this. Have they been to a wedding or some places where there's has been a propagation? So we're looking at it, but we know that the maps shows us that there's something happening in those neighborhoods, of course. But I cannot have a specific diagnostic. It's not. There's not a outbreak in a SCHSLD or someplace specific, sure. But we know there's something happening in the community.
Again, for the benefit of the audience, could you give me an English answer to Madame Lévesque's question about some 39% who were affected by traveling, you said?
No, it's 42% of the cases that we have right now that are travelers, people that have been traveling. And another like 25% or so is really people that have been in contact with travelers that were symptomatic or with cases. So we're still in grapes of cases, but we also have cases for which we cannot find a specific source. That's why we're saying that we are in a sustained community transmission of the virus.
Thank you so much. Une deuxième question pour Madame Plante.
Second question for Ms. Plante. Madame Plante, without wanting to play with fire, you also have the thawing period. Is the city prepared for those sectors? In French or in English? Perhaps in English if you wish.
So this is a good question because though we're dealing with the coronavirus, there's other things happening at the city, and we're looking at with the spring arriving, which we were happy with. There's always the risk of flooding. And last year was an episode where we were prepared well enough to really minimize the impact, the negative impact, and not to minimize some of the psychological or the stress, but at least we were able to very lower the number of houses lost. So yes, we are preparing. We're working with the different boroughs. You said Île-Bizarre, Pierrefonds, Roxborough, Annecy, but also some of the Villiers as well, just to make sure that everything is ready for that. But as you know, it's also about following the situation and kind of crossing our finger that the water, the ice will melt in a kind of, smooth way. So, but whatever happens, we will be, we will deal for sure.
Many thanks.
Anthony Restant from CBC. Just a few questions for the mayor. First, I'll start with the Royal Vic. What has been behind the delay in terms of opening the isolation unit or the shelter for the homeless? The sense I got last week was it would be a few days. Yeah. So what has been behind that delay? Why is it still not open?
I don't have the Réseau de la Santé avec moi, so they would probably be in a better position to give you like the very more details, but for sure, it's actually 2 floors or 2 aisles that we will be using, one for people that are waiting for results and the other one for people that are that needs to be treated. And so there's a lot of material that needs to be put there in terms also of making sure for the safety of workers, but also of the people that will be going there. So from what I understand, it's really connected of making sure that the site is prepared, well done to receive all the homeless population within the installation.
My second question is regarding the sites that the city is looking at setting up.
Yes.
What can you say in terms of the resources devoted to those sites in terms of manpower, equipment, and specifically what kind of figure is attached to those resources? Like what is the financial investment into those sites?
In terms of the financial resources, I will not be able to give you the numbers today because, well, with the state of emergency, what I'm glad about is it gives me the flexibility to move forward quite quickly. So we've already identified the spots where we want to do whatever is for the day center, all the night shelters as well. So everything is identified. We will be putting everything in place in the next coming days, and we want to do this very fast. And also everything related to food, because again, this is something that I'm sure I'm not the only one not comfortable with, the idea that, you know, some people are just cannot find food in the city right now.
So they'll be able to sleep, let's say, outdoors, or it'll be set up that way?
So there will be day center outside. For example, in front of the Resilience Center, we will put tents. So our new power gives us the opportunity to, you know, move fast with tents. There will be food there. There will be workers as well, social workers and people that work with that have the expertise. And we're also we have sites for people to sleep in. Let's not forget that though we closed the Royal Mount to get ready to be the kind of medical or operational medical site, we've already opened the Y and the Centre Guy Favreau to replace the Royal Vic. But what we want to do now is be more proactive in offering more beds. So the shelters, the night shelters, will be able to have less beds. So it's, you know, it's better we want to minimize the risk of contamination.
And I just have a clarification question. It's almost like a yes or no question from Dr. Drouin. You said in French 4 deaths today. I just want to be sure. So that's 4. It's
the total.
The total is 4. So it's not 4 today and a total of 5. It's 4 total on the island.
A total of 4 deaths in Montreal.
Okay, thank you.
Petite précision, Dr. Drouin.
Clarification, Dr. Drouin, because on those numbers you said at 9 in intensive care, 59 hospitalized and 4 deaths. The Jewish General Hospital said that they have 19 people in intensive care. I just want to make sure that I understand. The numbers that we give, I give the number that the Premier announces, but it's also always a number as of 9 p.m. the previous evening to avoid a whole array of hospitals. The Jewish Hospital also receives patients from other regions outside of Montreal. I'm talking about the situation of people who live in Montreal. So I have 59 people hospitalized, 9 in intensive care, and 4 deaths. But it is normal that the General Jewish Hospital has more people in intensive care because it absorbs also the neighboring regions. Thank you. If Dr. Arruda had not asked for the state of emergency, would you have done it anyway? In the present context, we're in a state of sanitary emergency, and the public health emergency was declared by the National Director of Public Health. He is the one who coordinates the action. So he delegates certain powers to me to a certain extent to be able to emit extra resources for the City of Montreal. But of course, we speak on a daily basis, so I recommended certain things to him as well. But it really is the way of working. So the actions that we're setting up right now are attached to the larger provincial plan. You really have to understand it like that. Montreal is not, doing things on its own and going rogue. The actions that we're going to be taking in the next few days are going to be discussed with him.
Just to start off, Dr. Drouin, a question for you and a bit of a follow-up after Madame la Mairesse. When you're looking at the maps and you're seeing how, looking at the epidemic, that's not the word I'm going to say.
That's okay.
That's all right. We all have those today. When I'm not an epidemiologist, but when you're looking at how these things move and how the cases are spreading, we've talked about how it was, looking in this the west part of the city. How are you seeing things spreading? Is that changing? Like, Outremont moves all onto the east side of Mount Royal.
But we had like the hotspot was at the north of the Mont-Royal, donc we see all the neighborhoods. But now we're seeing Plateau, Rosemont. Donc we're seeing it's really at the center of the island, and of course all the Faubourg, donc Centre-Sud. So we're really seeing it's really at the center of the island that we're seeing the spreading. But of course, we have some cases more at the east and west island. But maybe I think at this time it's more travelers that have came back, and that we won't necessarily see a transmission, a community transmission at the end of the island right now.
Okay, and Madame la Mairesse, just looking at how this new state of emergency and working with police, particularly trying to have crackdowns. Now, we've had some reliable tips come in of police stopping people alone in their cars, just saying, where are you going? What are you doing? Is this something that's already been put in place, or has an ordinance like this, or has it come down from on high to do this? And also, what about places like I live in the Plateau? I see all the people that do walk together, whether they are families or not, that are not necessarily 6 feet or 2 meters apart. Are when we're looking at Mount Royal at the park or Parc Jean Mance, are these going to be the places where we're talking about police in public that are going to be where we're not going to necessarily see a crackdown, but more so to ensure that the social safety measures and physical distancing measures are being respected?
Well, the presence of police officers will increase, and that's the whole point. It's one of the, well, not the whole point, because that's not what motivated us at the first to move forward with the state of emergency, but of course is to send a message that this needs to be taken very seriously. And though we know that for a family to be kind of close together is one thing, but of course people need to be super vigilant and to respect the 2 meters separation within whatever they're in the park or walking in the streets. And like I said, most of Montrealers, like the big majority, are following those rules. But it has to be, it's not time to stop doing those things. And as the City of Montreal, we're trying to be as proactive as possible, like closing the kids module, the Plateau Sportif as well. Even in parks, I mean, I don't want to close parks because, like I've said before, it's for a lot of people, it's the only backyard they have. So, but people need to be super vigilant. Like I said, there's many parks in Montreal. Though we love the mountain, we don't have to all go there this weekend, please. And if you feel like there's a lot of people, you should maybe switch, go somewhere else. And we've also decided to close the stairs because a lot of people addressed to me that the stairs on the Mont-Royal were super busy. So we decided to close those stairs for now. So, the city adapts, but the population definitely needs to continue to take those recommendations very seriously.
But are police being told at all to stop people in their cars to ask where they're going?
Where they're going, no, we're not there. I think it's, if we see a lot of people in a car, I'm sure a police officer would probably feel comfortable to say the distance, or like maybe, ask some question. But we're more into places outside, like I said, and to do some, to raise awareness. That's definitely what we will continue on doing. But if some people, if the police officers feels like some people are just reluctant and don't want to cooperate, well, they will be able to file a fine. Sorry.
Will Montrealers be able to continue taking walks in the cities of the city? It is probably the last thing that we want to take away from Montrealers right now. We wish for people to be able to continue walking around. Of course, the more you respect the distancing guidelines in the park, for example, when you walk, the idea is to, not go out and walk with a group of 5 people. So the more you follow the guidelines, the more we'll be able to not restrict that. For us, it's really important. It's already difficult, all the measures that we are requiring right now. Spring is coming. If we are forced to ask and implementing restrictions on that, we would be very sorry for it. So I believe that if everybody makes the collective effort of applying the rules, we'll be able to continue walking for a long time yet. The 4 deaths that you mentioned, Dr. Drouin, are these all elderly people? I'll be able to confirm. I do not have the numbers here, but I believe so. I know that 3 are, but the last one, I don't have the age. I have it in my phone. Sorry. Thank you, everyone.
Merci beaucoup.
Oui.